Our pathogen pair was otitis media and COVID-19.
Pathogen descriptions. Otitis media is a viral infection that is caused by a wide range of characterable respiratory viruses. This would include SARS-CoV-2, coronavirus, parainfluenza, followed by a combination of respiratory viruses like influenza A, influenza B, adenovirus, respiratory syncytial virus, rhinovirus. They are all the leading viral agents in otitis media. RSV has a helical shape, single-stranded RNA, and a lipid bilayer. Adenovirus is an icosahedral shape, double-stranded DNA, and has no envelope. Human rhinovirus, or HRV, has an icosahedral shape, RNA, and no envelope. Coronavirus is a spherical shape, has a single-stranded RNA, and a lipid bilayer. Parainfluenza is a spherical shape, has a single-stranded RNA, and a lipid bilayer. COVID-19 is also a viral infection. This is due to the viral causative agent known as severe acute respiratory syndrome coronavirus 2, also known as SARS-CoV-2. It is primarily spread through respiratory droplets when an infected person coughs, sneezes, or talks. COVID-19 can cause a range of symptoms from mild to severe and can lead to complications such as pneumonia and acute respiratory distress syndrome. Severe acute respiratory syndrome coronavirus is a spherical shape, has a single-stranded RNA, and a lipid envelope. Severe acute respiratory syndrome coronavirus 2 also is a spherical shape, has a single-stranded RNA, and a lipid envelope with spikes, also called pepilomeres.
Some signs and symptoms of otitis media are unusual irritability, difficulty sleeping or staying asleep, ear tugging or pulling, fever. Some other signs include loss of balance, hearing difficulties, and ear pain. If this is left untreated, it can cause permanent hearing loss, problems with speech development, or it can also cause tearing of the eardrum, which in some cases could turn into surgical repair. COVID-19 signs and symptoms are fever, cough, shortness of breath, fatigue, muscle body aches, and it can also cause headaches, loss of smell or taste, a sore throat, nausea, or chest pain. Most COVID symptoms go away within 5 days, but it can cause some serious long-term effects such as neurological symptoms, mental health conditions, joint muscle pain, heart pain, digestive problems, blood clots, rashes, or difficulty breathing. Experiencing any of these symptoms, a person needs to get help right away or it could cause death.
Routes of transmission. For otitis media, the causative agents can be spread through direct transmission of droplets. This can happen through actions like person-to-person contact through an individual that is already carrying the viral agent. In addition, these causative agents are spread through droplets particularly containing mucus from the nose or throat when around an infected carrier who is coughing and sneezing. For COVID-19, the causative agents can be primarily spread or transmitted through respiratory droplets when an infected person coughs, sneezes, or talks. These droplets can land in the mouth or noses of people who are nearby or possibly be inhaled into the lungs. It may also spread by touching a surface or object that has the virus on it and then touching one's mouth, nose, or eyes. This virus can also be spread through direct contact with surfaces that might be contaminated.
Some treatments for these pairs, acetaminophen or ibuprofen, are a good start for treatment for otitis media. These are common anti-inflammatory pain relievers. If that does not fix the pain, then patients can go to their doctor and be put on amoxicillin. If that does not work, they can move to Augmentin. Penicillin is also a good option. However, there are no antibiotics that will reduce the frequency of this infection. Some antiviral medication can be taken also to help with COVID, such as Paxlovid, which is taken by mouth, Veklury, which is an intravenous infusion or an IV, or Lagevrio, which is also taken by mouth. There are some preventatives also for these pathogens. Otitis media is most likely seen in kids. To prevent this, people can be sure to teach their kids good hygiene, such as washing their hands, not putting things in their mouth, or proper cleaning of the ears. This will also help prevent other illnesses. People can also avoid secondhand smoke, breastfeeding their baby, or talking to their doctor about getting their children vaccines, such as the flu or pneumococcal shot, which can also reduce the incidence. The biggest measure that can be taken to limit the chance of getting COVID-19 is getting the COVID-19 vaccination and staying up to date with it. The different vaccines are Pfizer, Moderna, and Novavax. Some other factors to try not to get exposed to are improving ventilation in your house, getting some time outside, staying away from others who have gotten it, washing your hands, cleaning more often, and if you have it, get the treatment right away, especially if you are at risk. A percentage of 80% children will roughly get otitis media during their life, and between 80 to 90% will get otitis media with an effusion, which is the fluid behind the eardrum. In 2017, there were roughly 700 million reported cases, and still to this day, the cases are very high. There have been a total of 111,568,359 reported cases of COVID and 1,216,502 deaths from when it started to now. Where are these most common? Otitis media is most common among children 6 months to age 5. It is also very common in poor, low-income regions because some families don't have enough income to provide healthcare for their children. Otitis media is most common in the country of Africa. However, it also affects Alaskans, Native Greenlands, Native Americans, and Australians. People who are more likely to get COVID are older adults, ages 50 or up, and people who are also unvaccinated and do not stay up to date. Other people who are more common are people with certain medical conditions such as chronic lung diseases, heart diseases, or a weakened immune system. The top 5 states COVID is most popular in are California, Texas, Florida, Pennsylvania, and Ohio.
Outbreaks and case studies. A case study for otitis media presents a 3-year-old girl with no notable medical history is brought in by her mother due to a fever and complaints of ear pain. The child appears distressed and has been crying during the examination. According to her mother, she developed a cold with sniffles 3 days ago. The child's temperature was 100 degrees Fahrenheit. Physical examination shows slight throat redness, thick green nasal mucus, and injected tympanic membranes. Besides the red eardrums, medical professionals contemplated other signs that could suggest otitis media and considered the ongoing debate regarding antibiotic treatment for acute otitis media. Diagnosis came to the conclusion of acute otitis media. Medical professionals were quick to provide information for treatment that included antibiotics, observation of the child to monitor symptoms, ear tubes or tympanostomy, and stronger medications like corticosteroids. The intended outcome of this study was to make sure follow-up appointments were made to see if the infection has subsided and pain management remedies. An outbreak in regards to COVID-19 has been seen in the greatest in Wuhan, China, when the start of the disease took the wheel. With that being said, the location of this disease stems from Wuhan, China itself. The source of this disease originated from a laboratory study within the hospital in Wuhan and traveled great lengths to India. More than 21,095,532 individuals experienced this disease. Most individuals had complaints of respiratory issues, loss of smell or taste, body aches, and chills. Treatments for COVID-19 primarily involve supportive care such as rest, fluids, and fever-reducing medications. In severe cases, patients might require supplemental oxygen or mechanical ventilation. While vaccines have been developed, the outcome has reported 50,122 deaths with 1,800,600 to 937 recoveries evident from August of 2020. Fun facts. For otitis media, statistics say that there are 3 out of 4 adolescents that experience otitis media by the time that they are 3 years of age. In addition, after a child experienced otitis media, they might be left with an effect based on the aftermath of the ear infection, which is called glue ear. Glue ear is when the fluid from the ear is trapped, blocking out air with the remaining fluid. A fun fact for COVID-19 is statistics provide data about the death count due to COVID. Since December of 2019, 6.9 million people have died due to COVID.